Hey everyone, it's Ed, and I'm super excited about this episode of Ed Talks because I'm with my friend Laura Fultz. Laura, welcome to Ed Talks.
Thanks, Ed. So happy to be here.
This is really going to be an interesting conversation because we're going to start off first with your title. So at Emory Healthcare, you're the VP of Apps, which is pretty normal, but it's also VP of Apps and Digital Experience. So can you explain digital experience and then maybe get into how your title came about?
Absolutely. So digital experience, we don't want to be seen that we are just providing applications to our end users. We're really about the whole experience. And so when they're using our technology, we want their experience to be the best possible. So that reminds our teams that we're not just building things, but we're creating a situation where our caregivers are working and using this technology. So it's about the whole experience and it's not just about what's on their screen. I also have another branch of my team, which is the user experience team, which I love talking about. I think it's a bit of a differentiator here. And one of the things that they do that I'm most excited about is a program that we call Emory Engage. And so the way that works is that we have a randomized group of users that get sent a note every morning that says, please rate your experience with Epic, 1 through 10. And then there is a pop-up box underneath that allows for any kind of free text comments. And so we gather that data back, and then we have a multidisciplinary team that's made up of analysts, informaticists, trainers, and the user experience team, and they read every comment. They pay particular attention to scores that were rated 5 or below. And then they follow up. And the feedback has been phenomenal because number one, people have said, I never thought in a million years anybody would answer this or that anybody would see this. We've been able to find trends and hot spots in areas where there's been multiple people saying, the system's so slow, I don't know why. And so then we call in our network friends and we say, hey, can you take a look? Or our Citrix friends. And so it's super exciting. And that's just the beginning because what we do next is that we'll pull in information from our ServiceNow system. We'll pull our information in from Epic, and then we give them a digital health score. So all of that together, and then we provide that data out to our service desk, to our analysts, so they really know, how is this person feeling? Like, have they had a really good experience or are they pretty angry? And so you're equipped and you have the right information at the right time to be able to give them a better user experience.
I love that. That is, I talk to a lot of people and you are all leading the way with that. A lot of people talk about getting to where you are and you are there already. That is cool. That's a great example of some things you're doing. What about wayfinding? I remember talking to Alistair on a podcast, which I'll try to remember to link into the show notes if someone missed it. He talked about the frustration with wayfinding.
Yeah.
How do you guys address that?
We were working with a new partner, Gozio, and so we have launched the My Emory Health app. And so wayfinding is a major component of that. And so we're live at 3 of our campuses, soon to be 4. And it allows patients directions from their house to our facility. They can save their parking spot, which I have used, and then gives turn-by-turn directions. And interestingly, we're also not just doing a patient app. We will have an employee version of that app. So our employees can also link out. It's really our digital front door.
Yeah.
And so from a patient perspective, it integrates with MyChart, it integrates with our website, and it's got wayfinding and more. From the employee perspective, it'll link out to PeopleSoft or our recognized point systems, and they can look at their holiday schedule and also get wayfinding for things like, where are the provider lounge? Where is this building that I'm in? I don't know how many times people ask me where, X meeting room is. And so we can use it for ourselves. So we're super, super excited and can't wait to continue to deploy it.
I had not heard about the parking spot thing. So literally on your app, you can it has a list of your parking and you
come into the deck, you say, save my spot. And so it remembers, and then you go right back to your car. Cause if you're like me, I'm like, boop, 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 where's my car?
I do it all the time. That's awesome. I didn't know about that. How do you work? Do you work directly with patients? Like when you come up with some of these ideas and things, do you have like a counsel or do you have?
We have a team that works directly with patients. We have our patient family advisors, and we, within Emory and our team and our governance model, we have a patient digital experience council. And so that's made up of the patient experience team. So we have a group of people that work in our transformation office. They're excellent partners, and their whole goal is understanding the patient experience, looking at our Press Ganey scores, talking directly with the PFAs. And so we have that group and a part of that digital patient experience council where we look at what are we, how are our numbers? Where do we need to improve? And then we use that data to then drive what technology can we add to improve that situation, make sure we're working on the right things. I have hired a corporate director of digital patient experience. And so that person oversees scheduling, registration, MyChart, the wayfinding app. Now, recently, our call center is a service software. And so because we recognize the importance of the patient experience and we wanted to have someone dedicated just looking at that particular area, and it has been hugely beneficial for us.
When I know the other things from talking with Alistair, and I know some of the things you're going to be coming up with Apple and other strategies, you all are definitely leading in the marketplace. I mean, this is amazing. I'm learning some new stuff here. This is great. So one last question, because people listening, your peers, probably wondering, how do you work with horizontally within your organization? So how do you collaborate with other peer groups in your organization that have sort of the same interest?
Yeah, we have, again, we have these steering committees that we have a patient care team, financial, research person. So it's not just if you're not a caregiver, but things that impact the entity as a whole, and sort of data foundation. So more of the technical. And so all of these different experience councils exist within our governance model. And I'll tell you, IT, the digital team, we have the least number of representatives, right? So it's really made up from our peers in operations because that is our job. We are there to support them through technology. And so we don't want to be driving this. We want to hear from them and then help guide them to how we can help get them to a better place and for, wherever they want to go.
Laura, you're an amazing leader. You're with an amazing organization. Thank you for being our guest on EDTalks.
Thank you so much. It was a pleasure talking to you.